Good afternoon, and welcome to the government's daily briefing on COVID-19 on this bank holiday as we commemorate Workers' Memorial Day. Today, I will address the significance of Workers' Memorial Day, particularly in the context of a worldwide pandemic, which we are in. I will also set out the guiding principles which will be applied to any decision for a gradual return to school as we start to come out of lockdown. I will, however, start by giving you the COVID-19 figures as at 8:30 this morning. Total swabs taken, 2,397. Results pending, 246. Results received, 2,151. Negative, 1,936. Confirmed cases, 141. Active cases, 10. Recovered, 131. These figures include the new random testing program for frontline workers, where 148 swabs have been taken and all of those are still pending. The results I have given show that since yesterday we have had 24 results received, with no additional confirmed cases. Still, we have 246 results pending, of which 148 are from the frontline workers' random sampling. In the last 24 hours, there have been 34 attendances at A&E, 8 with COVID symptoms. 6 of these were swabbed. There have been 2 admissions to the John COVID ward, and no new admissions to the COVID ICU. As I mentioned earlier, today is a bank holiday. It is Workers' Memorial Day. For many of you who have been at home in accordance with the lockdown regulations and government advice, today will not feel much different to other days. It is, however, important to reflect, particularly as we face the COVID-19 pandemic, on the significance of Workers' Memorial Day. Today we remember the sacrifices of all those men and women who have lost their lives or been seriously injured whilst doing their jobs. Men and women who went to work one day, as many of us do, and never returned home. Men and women who may have suffered an injury or become infected with a disease whilst doing their job, and who may subsequently have succumbed to that injury or disease. We honor, salute, and remember all those men and women. At no time has the significance of the loss of life for simply going to work been more poignant than these days, when we face the battle against this disease, and as we see thousands upon thousands of selfless individuals who put themselves at risk in order to help others, in order to save lives, and ultimately to help us in this battle against this virus. I refer in particular to those health and care professionals who, regrettably, some of them are paying the ultimate price by looking after and seeking to protect those that are infected and become ill. It is true, and long may it stay that way, that we have had no COVID death in Gibraltar at all, although we have had a number of health professionals infected with the virus. What we cannot do, however, is simply look inwardly and comfort ourselves with a low number of cases, a low number of hospital admissions, a low number of patients needing intensive care treatment, and the fact that we have had to date no deaths in Gibraltar as a result of COVID-19. What happens in other countries affects us. Indeed, as we have seen in this pandemic, what happens in far-off countries like China has a significant effect on all of us and on our lives. The virus has been brought to our shores. These days, we don't just look at China, but what also happens on our own doorstep, in Spain, in Europe, in the UK, with many countries still experiencing many hundreds of deaths every day. Until the virus is contained or eliminated, all of us are affected by what happens in these countries and even anywhere in the 4 corners of the world. In the same way, the efforts and sacrifices of many thousands of individuals around the world also affect us. Those efforts don't just try and save lives of those individuals in those countries, they help us in a collective battle, a battle of monumental proportions that none of us asked for or wanted. This is a global effort by all of us. The knowledge and data we obtain from the daily interventions and treatment of patients by health and care professionals, serves the scientific community as they seek to find a vaccine or a medicine that works against the coronavirus. It serves public health professionals as they devise their strategies to deal with this pandemic and put together their advice to governments. And of course, it serves governments and other decision makers as we consider the measures that are necessary to protect our communities. And so, on a day like today, Workers' Memorial Day, we do well to pause and reflect on all, whoever they may be and wherever they may be, who on a daily basis go to work to save lives and end up paying with their own lives. Spain alone, as we know, has suffered more than 20,000 deaths from COVID-19. It has been suggested that several thousands of those deaths relate to health and care professionals. In the UK, there was a report last week of at least 119 healthcare professionals having died from COVID-19. Doctors, nurses, surgeons, those in the ambulance service, hospital porters, receptionists, cleaners, those looking after the elderly in care homes, including care home nurse Lani Zuniga from the Philippines, who fought for his life alongside Boris Johnson in the intensive care unit at London St. Thomas's Hospital. The Prime Minister was able to recover and has now returned to work, but this nurse did not. He, along with thousands of others, went to the UK to serve and care for its people, and is just one of those workers who paid with his life for the good of others. We honor and salute them all and say thank you for what you have done for all of us. Earlier today, the Chief Minister, myself, and Unite the Union attended a wreath-laying ceremony at the lobby of Parliament. In contrast to other years, the number of people present was very small, and social distancing was naturally observed. We held a minute's silence, as we had previously advised our community to observe. In addition, the GHA held a 1-minute silence on the steps leading to St. Bernard's Hospital to remember and celebrate the lives of all those NHS healthcare workers who have lost their lives as a result of COVID-19. The minute silence was signalled at the start and finish by ambulances with their sirens. It is worth recalling the motto for Workers' Memorial Day: remember the dead, fight for the living. How appropriate at a time when we are all fighting for and contributing to the effort to save lives. Before I pass on to my colleague, Samantha Sacramento, I would like to say something about the steps to bring about the end of confinement insofar as it affects education. As the Chief Minister has announced, a route map out of lockdown is being planned and prepared by the government. We expect to be able to share that route map very shortly. One of the areas affected by the lockdown was education, with most of our schools closed, others operating a childcare supervision facility, primarily for children of key workers, whilst at the same time providing a meaningful and productive home learning program. As you would expect, our schools will be part of the route map out of lockdown. The Department of Education itself is preparing a roadmap for a return to school. This will be finalised in discussion and agreement with the Teachers' Union, NASUWT, and will be part of the government's route map. We had a meeting on this with the union yesterday, and we will have another one tomorrow. There are 4 guiding principles of the plan proposed by the Department of Education, which are designed to prioritise the safety and security of both the children in our schools and the teachers and other staff, as well as the safety and security of the whole community. The 4 principles are as follows. Firstly, a gradual, slow return to school, to be achieved with a prudent pause between each step. There are just 10 weeks to go from today before the end of term. 3 weeks and 2 days from that period are half days. We have not yet taken the first step for a return to school, and it will still be several weeks before we do. During this term, we expect to take 2 steps with 3-week pauses in between. It is our intention to apply the school calendar as regards half days and the end of term, although, as we have said on other occasions, no one quite knows what is around the corner with this pandemic, but still, that is certainly our intention. And it will be clear from what I have said that a gradual, slow approach with appropriate pauses between each step will not result in a return to school for all children, nor indeed for the majority of children. Most children, therefore, will not be returning to school before the end of the summer term. The second guiding principle is that public health advice on social distancing and hand hygiene is to be respected throughout the period to the end of the summer term. This means that children returning to school will be split between the morning and the afternoon, so that there is sufficient room in the schools for small classes, allowing the rules of social distancing to be observed. Thirdly, children who are at a critical stage of their learning journey are brought back first. In assessing the rationale for the order of the year groups being brought back to school, the Department of Education is considering every aspect of the needs of children of different years of education. Fourthly, the Department of Education and schools will maintain, to the extent and for as long as possible, the following services: home learning for those not able to attend school, childcare supervision facilities for those parents who need to work and who are unable to arrange alternative childcare without involving relatives over the age of 70, extended hours for children of key workers who need to work shifts. Once the specific arrangements are made and announced, a letter will be sent to parents informing them of this. For those whose children will be returning to school, details will also be given in relation to arrival and dismissal times and procedures, and advising children to bring a pencil case with their own equipment: pencil, ruler, pen, eraser, sharpener, so that the need for sharing is reduced and maintenance of social distancing is promoted and enhanced. As I have said, most children will not return to school before the end of the summer term. There will therefore be a need for some children to continue to make use of the childcare facilities which we currently have in place. The criteria to attend those childcare facilities will remain the same as they are at the moment. I would like to repeat them. These facilities are available for children whose parents need to work and who are unable to arrange alternative childcare facilities without involving relatives over the age of 70. Secondly, children attending St. Martin's. And thirdly, children not falling within these two categories, but where there are special circumstances requiring attendance at a childcare supervision facility, and this is approved by the Director of Education. And that will apply, for example, to looked after children or vulnerable children. No one should believe, as we start to take these steps out of lockdown, that there will be a return to normality anytime soon. That will certainly not happen. I reiterate that the return will be slow and it will be gradual. That is how we best protect those attending our schools and the community at large. That remains our priority. That remains our focus. And with that, I pass on to my friend and colleague, the Minister for Civil Contingencies, Samantha Sacramento.
Thank you, Gilbert. Good afternoon, everyone, and I hope that you are safe and keeping well. Thank you for being with us again at our information briefing. You've heard the statistics as Gilbert has read them out. We have the same number of people who are confirmed positive for COVID-19 today as we did yesterday, and that is double the number of people from when I addressed you almost a week ago, 6 days in fact. I say this as a reminder of two things. One, that the virus very much continues to be among us, and also that our figures could change at any minute. To get a better picture of how prevalent the virus is among us, the Director of Public Health has commenced another random swabbing process. This one will be focused on frontline workers. You will recall that a few weeks ago, the Director of Public Health undertook random swabbing of 400 people. Of these, 10 swabs returned positive for COVID. The current exercise, as we've heard Gilbert say, commenced a few days ago, and that involved 148 samples that we have taken from frontline staff, and this includes officers from the Royal Gibraltar Police and from the prison service. Generally, though, our numbers, while having increased, continue to be low. They are low because of the lockdown measures that we took early on. Containing the curve has enabled us to get ready for the surge. However, the more we move the virus, and let's not forget that. That is why our advice to stay home remains. This is particularly so for those who are over 70, because the evidence shows that people who are over the age of 70 are more vulnerable to be affected. As you will already know, tomorrow, the law for the over 70s lockdown will be changed and relaxed. As from tomorrow, that means that the law will allow for an additional exception to those that are already in place, and people who are over the age of 70 will be permitted to leave home in order to exercise. The risk of the virus, however, continues to be the same, and the advice to stay home remains. We have, however, following the advice of the Director of Public Health, made this provision in an attempt to balance the importance of safeguarding from the virus at home and the need to exercise and enjoy the fresh air. Because of the risks, we are taking measures to provide safe spaces so that people who are over 70 can benefit from this golden hour, and you will have heard me refer to this when I last addressed you. During the weekdays, and as confirmed by the Chief Minister yesterday, we have identified 4 locations that will be made available to people over the age of 70 only, and they may be accompanied by an adult member of their household too. These areas will be made safe by sanitizing them during the period of 10 a.m. to noon for those who wish to take this up. Now, that does not mean that people need to be there for all of this time. Indeed, the general advice, not just for people who are over 70, but when we discuss exercise, it has always been said that 20 minutes a day is enough for exercise. But our elderly population are, of course, very precious to us. We are doing as much as we can to protect them. But these measures which we have announced are, of course, no guarantee, and everyone needs to be mindful that the risk emerges the minute that you leave your front door. We have made provision for special facilities should you wish to take these up. But you have heard our clear advice on the subject, and the rest is up to you. I would like to dedicate some time this afternoon to speaking about mental well-being and mental welfare. Excuse me. We find ourselves in strange times indeed. It is not easy to stay at home for prolonged periods. It is not easy because it is not normal. Not much of we are doing of late is normal, is it? We have had to change the way we work, the way we see each other, the way we greet each other, the way that we celebrate birthdays even. Most people are by now getting used to the idea and managing well. We are, after all, a resilient community, and as a people, we have become adept to facing challenges over the generations. You will have heard me mention before that we have specifically set up a COVID-19 psychological and mental health support team to help us during this period, and I would like to give a summary of the work that they have conducted. The team consists of deployed government public sector professionals in the area of psychology, therapy, human resource management, and emotional welfare. Excuse me. The objective of this team, instructed by the Office of Civil Contingencies, is twofold. Primarily, as presented in prior press conferences, the COVID mental welfare team was tasked to establish a support program for essential services frontline staff. The second objective was to ensure systems and mental welfare support was established for the rest of the community. The past 5 weeks since this team was set up has seen them create and deliver repeat training packages on frontline resilience management. This has been delivered to the GHA, Care Agency, the Department of Education, and Elderly Residential Services. A total of 224 managers or key professionals have now been trained. Active listening training has also been provided to the education senior management teams. The training programme, called FRIM, has been adapted by the COVID welfare team from the trauma resilience management training. This training, offered to senior managers in charge of staff groups, enables structured welfare assessments for such staff to include an internal peer support system between managers and colleagues. Additionally, the tools supplied through this training further enable managers to conduct welfare checks at the start and end of shifts. Such welfare checks importantly help to identify which staff may require extra specialised provisional support. Such identified staff would then be further supported and referred to an in-house, on-site specialist counselling support service. This service has also been set up by the COVID-19 mental welfare team. The concept of professional on-site support during working hours lies in facilitating a space and opportunity to diffuse stress levels, enabling, where appropriate, a return to the workstation, and ultimately building staff resilience through a supportive network. This counselling support service for staff is already operational and offers 7 days a week support between 9 a.m. and 9 p.m. Currently, 7 counsellors from within the public sector have been placed on a rota to offer this service, and referrals can be made directly to them for anyone from within the public sector. This welfare service has also been extended to Customs, to Her Majesty's Prison, by the members of this team as well. And the team also additionally conduct consistent welfare visits. This welfare team also has at its disposal a team of voluntary counsellors to support people in the community for any pertinent issues that may arise, whether it's in relation to anxiety, fear, nervousness, stress, or worry in relation to COVID-19. This service has been operational for the last 4 weeks, and the counsellors for the community can be accessed via 41818, and they will ensure that people are contacted by a counsellor to work on any issues being presented. So as you can see, over the last 5 weeks, there has been a very well thought out plan by this team of professionals to ensure that the support is there, whether it's in-house to our frontline professional staff or to people who may be feeling anxiety in the community. Now, in order to supplement this, the team is also looking at online platforms so that automated help can also be provided by way of information, and they are also looking at developing apps so that general information can also be gathered. Now this week, this team will be launching a befriending service for people in Gibraltar, for people in the community who may live alone and may be struggling during these times. This service will be offered to people who have already been identified by the care agency as part of their audit process, or may also apply to become part of the service, and details in relation to the service will be made available during the course of this week. Now, what I have explained are new services, a new initiative that has been set up precisely for this period and difficulties that may arise for people in our community during this period. But of course, needless to say, existing mental health services that are provided by the GHA and by other agencies such as the Care Agency and Bruce's Farm also continue. They may be offered in a different way. Some counselling sessions may be offered remotely, but the services at Ocean View, at the Community Mental Health Service and Primary Care Service continue to deliver for our community in the same way that they have always done. I would like to thank the strategic team, the COVID-19 mental health team, and this includes K. Rajkumar, Sean Keating, Alfred Rovegno and Shane MacDonald, and they're assisted by Amy Cipollina and Kyle Bear. Lizanne Peralta heads the volunteers counselling team, and many thanks to all the counsellors who have given up of their time to volunteer their services. And this very essential team is led by Giselle Guerreras, and I'd like to thank everybody so much for the intense way in which they have worked to deliver for Gibraltar during this period. Moving on to other matters, a reminder that, as Dr. Awal said a few days ago, there will be another exercise to test St Bernard's Hospital and the Nightingale facility on Thursday, as we continue to prepare ourselves and be ready in the event that there should be a surge. Of course, we don't want to see that, but we need to be prepared nevertheless. Today's Regimental Day, as well as Workers' Memorial Day, I would like to pay tribute to everyone from the Royal Gibraltar Regiment, and particularly to its current and retired members who have worked so closely with us to support us through the COVID-19 pandemic. Thank you. Finally, as Gilbert has said, as Minister for Employment, he has today, with the Chief Minister, marked Workers' Memorial Day with the trades unions. And I have seen a video of the tribute that has been led by Minister Valvang and the GHA staff at St Bernard's Hospital today in honour of the NHS staff who have lost their lives to this. It was certainly very moving. Thankfully, this is not something that has happened here, but it's very right and fitting that the GHA have chosen to mark it in the way that they have. It is indeed a poignant reminder that we are all in this together, in Gibraltar and globally. We will get through this if we stick together, if we follow the rules and we follow the official advice. Let's not forget that this is a virus that is very new, and one that professionals continue to study and learn about, and the advice that we receive changes rapidly. We will always be guided by the clinical and public health advice in the decisions that we take. So on that note, I will repeat the official advice, which of course by now you know, is stay home and stay safe, wash your hands regularly, and if you sneeze, catch it, bin it, kill it. I would also say and invite everyone to be kind to each other and support one another and keep smiling as we will get through this. Thank you. I now move over to press questions.
A question from GBC News. The drive-through swabbing facility appears to be closed today. Is it government policy to only operate the facilities on weekdays, and if so, will it also be closed on future bank holidays and weekends? Do you agree that this adds unnecessary delays on tests?
It is not information that I have directly. These programs are governed by or run by Public Health Gibraltar. It is something that I'm going to take up. We do have a public holiday today, and there are some people who deserve to have a break as well. But the program is, of course, an important program. It is what is going to give us the information as we move forward in the battle against COVID-19. As we've explained on a number of occasions, as we start to ease out of lockdown and we start taking these small steps that I have described, or some of them I have described earlier, the testing program is an important part of that, as well as the contact tracing. So all of that is going to be built into the route map that the government is putting forward, and details of which will be given in the next few days.
I can add a bit more detail to that. I understand that there has been a very low volume of swabs that have been needed to be undertaken today. We have to be mindful in terms of the supplies that we have, and this is, as Gilbert has just said, something that is managed by the clinical professionals. And in terms of conserving our swabs and the reagent, it may make more sense for people to be swabbed and tested in batches.
A question from the Olive Press for Minister Sacramento. As indicated yesterday, recent medical research suggests that masks could be useful in stopping the transfer of COVID cases from those who might have it within enclosed spaces at least. With countries like Germany making it an offence not to wear masks in enclosed spaces like shops or public transport, will the government make protective moves to recommend the use of masks in these situations?
We've already heard the Director of Public Health give specific advice in that respect, and in particular in relation to the wearing of masks in enclosed public spaces.
Can I just add to that the advice is in fact very, very, very clear. The advice is that the use of masks is good in enclosed spaces, indoors, but only where social distancing cannot be observed. The main priority is to observe the rules on social distancing and a regular hand washing routine. Those are the best measures that we can take. But where that is not possible, where social distancing indoors is not possible, then the wearing of masks. It's important also to remember that we're not talking of masks in this sense as personal protective equipment. This is not to protect the individual, according to the advice that is being given by the Director of Public Health, not to protect the individual wearing the mask. It's to prevent the infection of others. So that context also has to be remembered, and the advice is very specific. If social distancing can be observed, that is what needs to happen. If it cannot for whatever reason, then masks in those circumstances are good to prevent the infection of others.
A question from the Chronicle for Minister Sacramento. There's a report in Spanish media about a shipment of testing kits being stopped at the border, apparently because they had not been cleared by public health authorities here after Gibraltar banned the import of all COVID tests, except those obtained through the Gibraltar Health Authority. Can you confirm if testing kits are being stopped?
You will recall that some weeks ago we introduced legislation so that any importation of testing kits could only be sanctioned by the GHA and the Director of Public Health. I am aware that Customs did receive a few of these kits, and these kits had not been ordered nor authorised by the GHA. We are being very strict when it comes to tests because, as you probably know, and it's been widely reported in the media, there's a wide range of tests available, but it does not necessarily mean that these tests are approved or reliable. And the reason for introducing this legislation a few weeks ago was to make sure that tests that are used are tests that the GHA is absolutely satisfied are the right ones, because we just cannot afford for people in the community beyond the GHA to be lulled into a false sense of security by using tests that are not approved by the professionals.
A question for Minister Likudi from YGTV. Before schools were shut and the new arrangements put into place, there were very few students attending. Does the government think that parents will send their children to those schools that do reopen in sufficient numbers before the summer?
Well, the schools will open, as I said, in a very slow and gradual way. The majority of the students will be at home. Parents will be advised of the particular arrangements that are made and of the circumstances in which they can send their children to school. It's not entirely correct to say that very few children were attending schools before we closed them, that we still had about 65-70% of children attending schools, so it was a significant proportion. By far, the best advice is for people to stay at home if they can, but we are making a provision available whereby certain year groups will be brought back to school in a phased way so that we can continue. And I mentioned that there are some students, some children that are at a critical stage of their learning program, and it is important, in fact critical for some of those children to have the benefit of what they're going to learn between now and the end of term so that they can be ready for the next stage of their learning in September.
A question for Minister Sacramento from from the Olive Press, Have you considered the privacy concerns made by digital rights groups like the ADA Lovelace Institute over contract tracing with the possibility of fraud and abuse, as well as the fact that many of the most affected, the elderly, do not have smartphones themselves in Gibraltar?
Well, in relation to the contract tracing exercise, we are, of course, very mindful of privacy issues, and we have taken legal advice on the matter, and it's also been discussed at length with the GRA as the regulator on data protection. We are very mindful where we have to balance the collection of information to be able to guide us in formulating policies which are in the public interest, and of course making sure that this information is absolutely safeguarded and that people's privacy is respected and personal data is protected. And we are, of course, also very mindful of the fact that people who are over a certain age may not be that familiar with devices, and it's not as simple as asking someone to fill details into an app. But in that respect, and in respect to that particular demographic, some 5 weeks ago, we embarked on a telephone audit on every single person who is over the age of 70 who lives in Gibraltar. This exercise is now almost complete, and everybody who is over the age of 70 will probably by now have been contacted by someone from social services or one of the teams who have been deployed to support social services in this exercise, and they will have been asked a variety of questions. So that means that we now have at our disposal a very comprehensive database of people and their details. So should we need to reach out to them and contact them in the absence of alternative sources such as an app, then we can also easily do so, because now we know we have up-to-date and accurate telephone numbers and contact details for these individuals.
A question from YGTV for Minister Sacramento. What lessons were learnt during recent exercises at St. Bernard's and the Nightingale facility? From a civil contingencies perspective, are you satisfied that all agencies are able to work together under pressure?
Well, I think that if I can start the answer to that question by saying that from the minute that the pandemic was announced, everyone has worked under pressure superbly. And it's been very apparent how everyone from the GHA has really worked extremely hard to have our existing hospital ready to be able to deal with this, and in a very short period of time, particularly by Stuart Ben-Savong, to build ourselves a hospital in a number of weeks. Now, we have used this opportunity whilst we have the Nightingale facility, which continues to be empty, and a very quiet St. Bernard's Hospital, to test ourselves. We've done that on a number of occasions already. We've tested the Nightingale facility twice, we've tested St. Bernard's Hospital once, and on Thursday we'll be having a test run of both hospitals together. These exercises have given us an opportunity to validate these practices and procedures. Things have been identified. They haven't been major things, they've been minor things, but I am extremely satisfied at the way that everyone from the GHA has worked to provide the facilities and the systems that they have.
A question from the Chronicle for Minister Likudi. How many students are expected to return to schools? What strain will there be on teachers and children navigating a mixture of home learning and school learning in this critical stage?
As I mentioned earlier, what I've given are the guiding principles. We are in the middle of discussions and agreeing those arrangements. Those measures will be announced in the next few days. We're putting together the government route map in respect of easing out of lockdown. It includes provision in respect of schools. I also mentioned earlier that the majority of the children will be at home. I did mention the home learning and the childcare supervision facilities, but I did say that one of the guiding principles is that to maintain this to the extent and for as long as possible. So we have to marry a few things here between now and the end of term. We are just taking a couple of steps in the next few weeks, so these won't be massive steps or massive strain, and I'm certainly very confident that these are measures that are not just doable but are practicable and logistically and from an educational perspective also make sense.
The final question from GBC News. How will exercise by over 70s be monitored? For them not to mix with members of other households during exercise periods in non-designated locations. Will marshals be deployed to ensure the outing is for exercise and not socialising?
The answer to that is yes. First of all, we need to be mindful that our starting point for this is the relaxation of the lockdown measures. So that is a general exemption that is made, and we hope that people take into account the public health advice, first of all, to stay home, but if it is necessary to leave home in order to exercise, to do that for the minimum amount of period and amount of time, and to observe social distancing and avoiding touching spaces, etc. Now, what we have done in order to be able to create what we would describe as safe spaces is that we have identified 4 areas which, for the period of 2 hours a day during weekdays, will be cordoned off for the exclusive use of people who are over 70. These areas, and one of the reasons we've identified these areas apart from them being large, is because we can control the entry and the exit, and they will be controlled by the Royal Gibraltar Police. And they may well be assisted by officers from the Customs Department and the Gibraltar Defence Police. They will also be supported by marshals who will be identified as marshals from, and these people will have been redeployed from other public sector departments, primarily the GSLA, who are very experienced at organising these functions, and the stadium is one of these safe places. We also have people from the Department of the Environment and from the Technical Services Department. And as a team, both the official uniformed bodies and our marshals will be controlling the entry, and people, as you know from our press release yesterday, will be asked to carry some form of identification, so that those at the entrance to these areas can verify their age. And the marshals will also be around these spaces to ensure that social distancing is observed, and so that people are encouraged not to socialise, etc. Our advice, our official advice on this matter, is very, very clear, and people need, particularly people who are over the age of 70, need to keep these opportunities to a minimum. Now it's up to every individual, knowing the risks that are available and how these could affect them, to safeguard themselves by following the rules as much as possible. But certainly in the safe areas, these will be monitored and policed, because we want to make it as safe as possible for these people. But safety is not guaranteed once you leave home.
Okay, thank you. No more questions.
Okay.
Thank you.
Thank you. Thank you very much.
And thank you, Samantha, for accompanying me today on this bank holiday in which we commemorate Workers' Memorial Day. These are undoubtedly difficult times, that we have said many, many times before, and there are immense challenges still ahead. We should not think that we are out of the woods of this one. And even as we start to take steps out of lockdown and easing some restrictions, but every step that we take will be reviewed on a constant basis as we monitor the effect that that step is having, and that we ensure that the conditions, the preconditions that we set ourselves for unlocking, continue to be met. And just as we have all made huge efforts to stay at home and stay safe, the message that we are constantly giving and we have repeated on a number of occasions today, it will be necessary for everyone to cooperate as we start to take small, tentative, gradual steps out of confinement. But whilst all of this takes place, our advice will continue to be that unless it is absolutely necessary to go out, you should stay at home. And if it is necessary to go out, maintain and observe the rules on social distancing and hand washing, as these are the rules that have been shown to be the best measures to protect yourselves and to protect others. Thank you and good afternoon.